Hello, this is Becky Parkey with the Parkey Group. I am doing a part 2 to how to find a therapist. Scott emailed me and he followed all the steps from my part 1. And I am really appreciative of him doing that because basically he was able to find a few flaws in the system. And basically, one of the things that he found is some things that I hadn't really discussed in my last video. So I'm going to just read part of what he sent and talk about it. So, what he said was Psychology Today is not used by the vast majority of providers in my area. What I want to say about that is very possible. He said there are about 170 providers listed by my insurance, and Psychology Today only produced 35 psychiatric providers. So he says, for psychiatric providers, and I'm not 100% sure if he was looking for psychiatric, meaning prescribing medication, or if he was looking for therapists. So before I go on, I'm just going to briefly talk about the differences because he had mentioned this in his last email as well, and I didn't go into depth about expressing and explaining this. So basically, when you are looking for someone who is going to prescribe medication, that's a psychiatric provider, and that person does not do therapy. So that person is just going to meet with you between 15 and 30 minutes, and 30 minutes sometimes is a lot more than they even do. During the first session, typically they'll meet with you for an hour, but after that, it's between 15 and 30 minutes, and it's once a month, and then once you're doing really well, it's usually once every 3 months. So it's very different than a therapist who will meet with you typically once a week, unless you're not doing very well, and then maybe it's a little more than that in the beginning. But for the most part, therapists meet with you once a week, and they're the ones who do things like CBT, which is cognitive behavioral therapy, or other types of interventions. He's specifically asking about CBT. So a psychiatric provider would not do CBT. They would only meet with you, discuss different medication options, discuss a diagnosis per se, things like that. So I just wanted to clarify that. Also, he says that of those 35 providers that he looked up on Psychology Today, 19 say that they take his insurance, but only 4 are actually listed by his insurance company. So one is affiliated with the system that he cannot be a patient of, and that leaves 3. So there are 3 or 2 that do not have on their profile what he is looking for, which he had mentioned looking for someone who does cognitive behavioral therapy. And so basically what he is saying is he would really like to be able to have more options. The first thing that I want to say is this is very common, and one of the things that I did not discuss previously is typically and really all of the time, Psychology Today is people who have private practices or groups with private practices. So these are not people who are affiliated with different companies like community behavioral health clinics, or could be the VA, or it could be different hospital organizations that have mental health clinics within them. So basically, those clinics have ways for insurance to be taken, which is what some of those 170 providers likely work for. And so you're not going to find those on Psychology Today. And I didn't mention that previously, which really was my fault. So it's important to know that when you're looking for therapists with your insurance provider, those therapists are going to be, or those providers are going to be listed, and they're not going to be on even a search engine typically looking for providers. So when you contact your insurance company, it's going to list all the different providers that you can see that are in your insurance. So if you want to start contacting providers that do cognitive behavioral therapy, or that you can talk to see if you have a good connection with. I highly recommend it, because yes, it's great to see people in private practice, and I'm a huge proponent of it because I'm in a private practice, but sometimes it's just not viable because you need to see people who are in your insurance. So hopefully this is helpful, and know that there's a lot of different clinics that do take insurance, and they are networked purposefully. They spend a lot of time to get networked with insurances, which is really helpful for people. So hopefully this is helpful. But I will say that, for instance, if you go to like a community behavioral health clinic, or to say, for instance, like the VA or different places, you're going to call, you're going to make an appointment, and then they're going to put you with a therapist that has an opening. That's not a bad thing. But you may or may not click with that therapist, and then you may get moved around. So that's just the ins and outs. Hopefully this was helpful and understandable, and please let me know if you have any other questions. I appreciate all the questions you send, and hopefully next time we'll be doing some role plays so you can see what goes on inside a therapy room. Bye.